evening and welcome. You're watching Interface Live on SABC3. Health Minister Aaron Motsoaledi has announced pilot projects to implement the National Health Insurance Program. The healthcare system aims to ensure that all South Africans receive quality healthcare. The minister says the pilot project will ensure that the healthcare system is strengthened by forging partnerships with the private sector, emergency and trauma services. Now, tonight we discuss the state of public health in our country, public health facilities, as well as facing a crisis. That's the main question we're also asking, ranging from shortage of staff, lack of proper facilities and overcrowding. And sometimes these challenges have resulted in claims against the health department. Now, remember you may join this discussion by sending us your comments to 33726, that's 33726, or like or unlike, if you will, us on Facebook. That's our Facebook page, that's Interface on SABC3. Our guest this evening is Kerry Cullinan, Managing Editor of Health E-News. And later on, we'll be joined by Dr. Nomondo Kundu, she is the head of department for Gauteng Health, as well as DA spokesperson for health, Mr. Jack Bloom. But continuing the discussion and welcoming to you, Kerry, thank you for your time. Perhaps just from layman's point of view, yes, we all understand that there is a crisis within the public health care, and to an extent people will say, well, perhaps the private health care is not far off, particularly from a financial point of view. But what is really wrong with, particularly from your perspective, which you write on a daily basis, with South African health care?
I think there's a big problem in public health care, in particular because there's a lack of resources. You've got 80% of the population dependent on the public health care, but only 20% of health expenditure in the country is on public health. We've got a lack of leadership and a lack of accountability, and mixed into that is mismanagement. And the third issue, which I think is a problem, is something called fiscal federalism, where the provinces are able to, they're supposed to implement health policy, and they can spend the money as they wish. And
well, that's quite a mouthful, but let's unpack that very clearly in what you are saying so we can understand that as well. When you say lack of resources and management or mismanagement that take place, resources alluding to the technical know-how, the experts that we perhaps don't have a shortage of, that seem to be populating the Middle East, the Far East and Europe, and mismanagement in what sense really?
Lack of resources, we're short of everything. We're short of healthcare workers, we're short of doctors and professional nurses in particular, and we're short of money. Mismanagement comes from people who are maybe not qualified to be in their jobs, who are running big hospitals and they shouldn't be. And there's a lot of corruption as well, tender irregularities in a lot of the provinces.
That makes me concerned when you say people not being qualified to run a place of healing, a hospital. Surely there are certain guidelines, rules, regulations and laws that prescribe that.
Well, the health department has just announced that all the CEOs of the big hospitals have to reapply for their jobs because some of them are not capable of running the hospitals. Do they need to have a medical/paramedical qualification or clearly just management? They haven't had to, but the health minister says that they find the people who do have a medical background do much better.
Leadership? Accountability?
Well,
we find that within the political sphere, but surely not when it comes to humane issues, something as mandatory as healthcare.
What concerns me is that every day you hear about abuses in hospitals and clinics and so on, but the people who are abusing the patients, treating them badly and doing operations that go wrong, mostly they don't get punished. Somehow an inquiry might happen and somebody might be suspended for a couple of days, but there's no proper accountability. From the cleaner who doesn't clean the
That doesn't bode well
theatre.
for argument's sake, let's say the regulating body like the Health Professions Council, for argument's sake. They should have their hands full in dealing with these matters.
It's quite complicated because different health workers report to different people. So you'll have a nursing manager and she's responsible for nurses. Somebody else will be responsible for doctors. You don't find one person who's responsible for everybody. So people slip through the cracks and it's easy for them to avoid accountability.
Fiscal federalization, what does that mean? Is that you would be in favor of having a centralized approach and the money is in one kitty and then distributed equally?
I would prefer it if the national government had a little bit more say in exactly how the provinces spend their money on health. Because some provinces, they get a health allocation and then you'll find that a massive amount of it goes to the bureaucracy instead of to the hospitals or to the doctors.
Okay. When one looks at what the NHI says there and the pending rollout thereof, Minister just said the other day, we have to make sure, we as in the people in charge of the sector, the healthcare sector, that the environment is conducive to these pilot programs. And what you are just saying is that, no, we're far from that.
I think that's why I think that the approach of having pilots is a very good one, because pilots is where you see where the problems are. So try it out. They're trying it out in 10 districts, 1 in every province and 2 in KZN, and they're going to try those out for a year before they roll them out to all the other health districts.
Of course, this is a question I need to ask the politicians also and the administrator later on in the next, just after the ad break. But concerns of, and you've alluded to some of them, people not being treated with dignity, respect, etc., which incidentally would just make them worse their conditions. But the other role players, the service providers, these are all professionals, and if they don't meet their duty, so to speak, by particular deadlines, then there's no way that the system would be able to work, whether it's when it comes to delivery of certain equipment or assistance within theatres, etc. I mean, we'll be in disarray. Is that what you are saying?
I think that a lot of the provinces
surely
are in
it can't be
disarray.
that bad.
Well, if the biggest and most powerful province in the country can't pay its bills, I think we're in quite a serious problem.
Do we have certain issue, at least certain examples? Can you mention 1 or 2?
Well, Gauteng Health owed the laboratory services 2 billion rand. They just didn't pay. They just carried on rolling over and not paying until the laboratory services withdrew their services. So you couldn't even have TB tests, specimens tested in the laboratory to see if people had TB, because they hadn't paid their bills. I mean, you and I know, if we don't pay our bills, the service providers come down on us.
So your opinion, there's a serious disconnect between that, what the minister is saying, and what really is happening on the ground?
I think the minister is trying his level best to put right years of mismanagement in all the provinces.
Well, if that is in fact the case, Kerry, then it's all pie in the sky with regards to rolling out the pilot program of NHI. Please, Kerry will join us again in a wee bit. After the break, we'll be joined by DA spokesperson for health in the Gauteng province, as well as the HOD of the Department of Health here in the Gauteng province. Please don't go away. Don't forget, you can send us your comments to 33726 regarding this topic. Also, like or unlike us on Facebook. Our Facebook page is Interface on SABC3. Don't go away. We'll be back right after this. Welcome back to Interface Live on SABC3. Access to healthcare is a fundamental human right, but limited resources, maladministration and corruption in some instances make this a serious challenge. Anthony Geza has been traveling from his home in Vereniging to Charlotte Maxeke Hospital for cancer treatment, which he could not get for 2 weeks.
I wouldn't wish for any other patient to go through what I've been. It's painful. You become stressed. I was starting to get worse, and I thought they were ignoring me because I was going to die, or because my illness doesn't have a cure.
And Neil Kirby, joining us in the studio is Dr. Nomondo Kundu, the head of department for Gauteng Health and DA spokesperson for Health, Jack Bloom. In fact, I was mentioning about Neil Kirby. Good evening, ladies and gentlemen. We'll be coming to that insert later on. Thank you for your time. I'd like to start off with you, HOD. Just before we went for the break, some profound statements were made with regard to healthcare practices within hospitals, and your setup within the Gauteng province was not exempted from that. And this is really where we have patients, and as we've had there, Mr. Anthony from Vereniging Keke as well, alluding to it, where the inhumane treatment that they've been getting. the disproportionate level of interaction between the healthcare practitioner and the patient. Now, please, can you shed some light on that?
Thank you, Jerome. We do have challenges in our health facilities, which is why the National Department of Health has put together.
Let's not generalize now. Let's talk to the actual issue here. I mean, there we have someone who's got cancer, terminal, wants to go for treatment, couldn't get it for 2 weeks. Was this brought about to your department? Machinery was not in order because apparently, as it was stated by the journalist, the service provider wasn't paid.
That's one case too many, actually. It's not this kind of situation that we'd like to find ourselves in. But having said that, if you look at the general kind of health outcomes of the province in particular, if you look at the regular outcomes that we monitor in terms of mortality rates, in terms of maternal mortality, in terms of child health, even with the challenges that we have in our facilities, we're finding that we're actually not doing that badly. We know that we could do much better than we're doing, but if you look at what has been happening in the past 5 years, even within the constraints that we have, child mortality has gone down in the province. AIDS-related mortality has gone down. We're improving the TB treatment outcomes. But of course, when you look at individual cases, you find those challenges that relate to management of infrastructure, the attitudes of health workers to patients, and some other related issues.
You're the accounting officer, surely, and you should know about these things, and the buck would stop with you in terms of signing things off. And yes, we have tried to get your political head here to really give an account of these things, because he's got to go out and talk to his constituency. But speaking of which matters, politics, you're supposed to be the watchdog, Mr. Bloom. It's all happening on your watch.
Well, in fact, I assisted Mr. Anthony Keswer to get his cancer treatment at Johannesburg Academic Hospital. The problem was that the service provider hadn't been paid, and that's why the radiation machine was broken. But it wasn't just that hospital. The Steve Biko Academic Hospital, 2 machines were broken. You know, if you're a cancer patient, I think your life is actually at threat because of delayed treatment. It's not just cancer patients, it's just the general mistreatment of patients in state hospitals. You go to any hospital in Gauteng tomorrow and you'll see long queues. You know, that's the name of the game. Long queues, shortage of medicines, and surgeons who come to work in the morning not knowing if they'll be able to operate because something might be missing, the anaesthetist might not be there, the machinery might be broken. It's very stressful for both.
Within the public domain.
Within the public domain, very stressful for both patients and staff.
But let's go to Kliptown, because here we have a situation where angry patients vented their frustrations during Premier Makunyana's visit to a clinic in Kliptown.
Premier here is that you are being treated like a trash, especially if you are a referral patient from Bara. Yes, on Monday I was here. Nurse Priscilla, you understand, made a fool out of the patients to say that the nurses are on strike. And what?
Well, perhaps we stick to the up sounds, because I want to link that with the healthcare lawyer Neil Kirby, that says patients should know generally what their rights are and what is going about around them. Perhaps linked to that, and had that lady known what her rights are, things might have been dealt differently. Let's have a look. Okay, perhaps not now. We'll get to Neil Kirby's insert later on. HOD.
I was actually at that visit, Jerome. That lady had a card with her, and she gets prescription for epilepsy treatment. The prescription said, what was written on the card was 100 milligrams of this particular tablet a day. And how she interpreted that was she's supposed to be getting 100 tablets. And she was unhappy that she's not getting these 100 tablets. It's 20 of 100 milligrams tablets. I think it's a point that you make of having people educated on what to expect of the system. Yes, within that visit, we did note that there's long queues, which relates mainly to administrative elements of the provision of that care in that facility. We are concerned about the infrastructure in that facility. There's this room where you're supposed to be managing TB patients, and it's hot, and air doesn't circulate properly, and when patients sit in one room like that, within the facility, you get easy spread of disease.
What has been happening in this country, to break your rhythm there, has been the issue of medical-legal issues, and that's been the flavour of a long time. That's been, and of course, the long time to come still, and it seemed to be very lucrative. Let's have a look at what lawyer Kirby says about people and their rights.
To understand that you have rights under the Patients' Charter, which is published by the Health Professions Council of South Africa, and you need to understand that you have rights as a consumer, that you are the receiver of health services. And a great amount of time has been spent by our Parliament putting together these pieces of legislation in order to protect both the patient-consumer in the context of the receiver of the services and the patient who needs to have access to services that, but for certain administrative problems, would otherwise be available. People have this perception that public health care is failing. And people also have the perception that there's nothing being done to stem this failing or this failure. And we as members of the public, even as campaigning for cancer, or even in my capacity as an attorney, it's very difficult for us to understand the problems. It may very well be that it could be money. There might not be resources available. It could be personnel. There may not be enough doctors available. It could be both. We don't know. We don't understand those difficulties because they're not shared with us.
Neil Kirby on patients and their rights. So we're going to be taking a break. When we come back, we'll explore exactly what he had said and perhaps ask the question, whose duty is it, in fact, to go and convey the message to every South African. Please don't go away. We'll just continue with the discussion right after the break. Welcome back to Interface Live on SABC3. Last week we asked our viewers to send us their experiences at healthcare facilities. Now, the following email is from Octavia Ngungu, whose mother is still waiting for a surgery to repair leaking heart valve. After several visits to the hospital since 2010, she says, my mother, Rebecca Mankeni, was diagnosed with a heart problem. She writes further that on the 1st of March, she went to Charlotte Nkeke Hospital for her treatment, where she was admitted because she was too sick. On the 20th of March, her doctor told us that nothing can heal the leaking valve except an operation, but the hospital does not have the valve sutures needed for the surgery. Doctors say there are only 2 government hospitals which can perform the operation. Another alternative would be private hospitals, which are very expensive. South Africa has just marked Human Rights Day, she writes, and continued to say, what rights? That's the question she asked. Does my mother have rights to good health? What frustrates the family is the Gauteng Premier has assured South Africans that they have paid the suppliers. If the suppliers were paid, why is my mother still stuck in hospital? We've touched on certain of those issues there. HOD, again, coming to your competence and your responsibilities. Please, your comment to Mr. Jack Bloom and also from Health E News. HOD.
It's said that that mother had to wait so long for that kind of treatment. But what we are finding is that even as we pay suppliers, it doesn't translate to the supplies being given to the department for various reasons. But it's not only the question of the supplies. It's not only the question of equipment. It's a province that provides a tertiary level care, and it supplies that kind of service for the whole of the country. And you find that there's long queues waiting for people for the kind of service that may only be in most
That's
instances.
a given. We have long queues at all hospitals in the country. But you can give us the guarantee, you can give the guarantee to the writer there that there's nothing wrong with your procurement processes.
I cannot say that procurement process is 100% correct. Of course, we can improve on that. There has been challenges.
What did your audit report say? The last one that was done, surely that would have reflected, i.e. that too.
It does. It does. If you look at the Auditor General's report, we are the only department in the province that has a qualified audit report for various reasons, and one of them is our supply chain management system.
Well, if
which
it
we're
had
working
been
on.
qualified, that's not too good news, is that now, Mr. Jack Bloom?
No, the Gauteng Health Department's had an appalling record over the years. In fact, there's 1 billion rands worth of contracts that's being investigated by the Hawks. Now, the problem is there's been massive corruption, inefficiency. Quite frankly, we need better management. We need good hospital administrators. I think there need to be sweeping changes because the experience of patients at our hospitals and clinics is not good.
What would be a sweeping change? Like NHI's intervention, that would be what? Would that carry,
What
at
we
least
must-
alleviate some of the challenges?
We must start with getting the basics right, like they have done in the Western Cape Health Department, when things by and large work well, because we have the best people that we can get to run
You're not
hospitals.
just saying because Western Cape is close to your heart now, are you?
Well, it is run by the Democratic Alliance, but we apply the
This is
principles
serious,
of...
Mr. Blue. We're not talking politics here. This is a serious matter of health and death here. Again, coming back to the role that you are playing in the provincial legislature as the watchdog, surely you must get some of that blame too.
Well, I've ceaselessly posed questions in the legislature. I was once banned from the Chris Hani Baragwanath Hospital because I was snooping around, as they said, and I've kept up the pressure because, quite frankly, there's so much waste and mismanagement, but it all starts putting the right people in the right jobs. And that's where this Gauteng Health Department has failed abysmally, whereas, let me take the Western Cape Health Department, they've got it largely right.
Carrying the message, Kerry, to civil society through the work that you do you get a sense that ignorance really is of a significant, is a significant factor, and that there's a lot of work to do still? And by the same token, who should be the persons doing that job, taking it to Joseph?
Look, at the moment, the patient's charter isn't really worth anything. It's like toilet paper because there's nobody who's taking patients' complaints seriously. But the government is trying to address that. They're introducing ombudsmen in all the provinces so that you can complain and there'll be somebody who will address it. Because at the moment, you complain, you say, these are my rights, and nobody's taking patients seriously. So I think there is something being done now, finally, to address the complaints.
Well, patient charter, perhaps we don't have the time to really explore everything that it says and what the successes thereof is. But now coming back to some of the intervention, making really efforts to try and alleviate some of those problems. NHI, would that be one of them?
Look, it's
at the backdrop of the territory not being conducive for the rollout of some of the pilots.
I think the first thing for an NHI, if you're serious about introducing it in whatever form, is to get the public hospitals right. If you're not getting public hospitals right, the minister is very critical of private healthcare, but quite frankly, he must start in his own back garden. He must make sure that suppliers are paid on time. I mean, that's absolutely basic. That well-qualified people are put to run our hospitals, that there's corruption and inefficiency and eliminated. If we do that, then we've laid the foundation for a good healthcare system.
Would matters turn around at one of your biggest training hospitals, the Chris Hani Baragwanath Hospital, now with the pilot project looming?
Oh yes, to the extent that the NHI actually is focusing on re-engineering of primary health care. We believe that promotive and preventive health interventions are the best way to make sure that people live long, healthy lifestyles. You spoke about social mobilization. Whose the responsibility is it to see to it that people understand how to utilize the health care? We would like actually to close our hospitals if we could get to that point. Important thing for us is for people to live healthy lifestyles.
Close hospitals? In what sense?
Because people are healthy. They don't need health services.
And you'd be out of a job, HOD.
I want to work myself out of a job.
Oh, absolutely. Just quickly, we don't have much time. Again, the area being conducive for the rollout. We have cleaner hospitals now. That's a good place to start. Technical things are falling into place and machinery are being calibrated more than normal, etc. And then everyone can learn and be a happy healthcare family. Or is that now really pie in the sky? Very shortly.
We have a very good health minister who is providing leadership, and he is trying to introduce basic standards that everybody, private and public, have to adhere to. And that's
we have a good
start.
healthcare minister. I will leave you with that message there. Otherwise, they'll be cutting us from the air. That's it for tonight. Thank you very much, ladies and gentlemen, for your time. Interface will continue again next week. It's unfortunately farewell from me, but the team will be back on its place next week. Don't forget, you can catch us on Facebook, as also, or you can send your emails to Interface. From me, Jerome Topley, it's good night, and also from the team, enjoy your viewing on SABC3.